Gorakhpur tragedy, as many as 55 other infants have died due to lack of proper facilities in the special newborn care unit of the Nashik Civil Hospital last month. This comes just days after 49 children were reported dead at a hospital in Farrukhabad, allegedly due to lack of oxygen. In Gorakhpur too, 63 kids had died in a span of 5 days, leading to allegations of medical negligence. And it was alleged that the hospital was running short of oxygen, and neither the authorities nor the government did anything to prevent those deaths. Since April, 187 infants have died in the unit, with 55 deaths reported just last month. Hospital authorities, however, denied reports that the deaths were caused by medical negligence. It is being alleged that the main reason for the deaths was due to the lack of ventilators.
पिछले 3 महीने से अप्रैल तो अगस्त से जो डेथ हुआ है, जून में 262 के अगेंस्ट 35 डेथ है, जुलाई में 1314 के अगेंस्ट 46 डेथ है और अगस्त में 346 के अगस्त में 55 डेथ है। हमारे स्टाफ का कुछ कमी नहीं है, ऑक्सीजन सब कुछ बराबर है। एज लाइक प्राइवेट के लेवल का हमारे एसेंसी है, हमारे नियर अबाउट 10 to 12 पेडियाट्रिशियन अवेलेबल है, पूरा ये 8-8 घंटे का उनका ड्यूटी रहता है। और दूसरी बात मेडिसिन और सब कुछ हमारे उसका कुछ भी कमी नहीं है।
And we have a correspondent, Pragya Jha, joining us right now on the phone line from, in fact, Mumbai. Pragya, another incident, repeated incidents being reported on the premature death of infants. Another one coming in from Nashik. In fact, 55 infants died just last month. What really happened? And in fact, the hospital authorities, you heard, are denying that there was any lack of ventilators or that the infants were admitted to the hospital at a very later stage.
That's right. You know, we saw that Suresh Jagdale, the civil surgeon at the hospital, has told the media or has told reporters there that most of these deaths occurred because infants were brought from private hospital in a stage in which there is less chance of recovery. He says that the deaths were also due to reasons like premature birth and lung weakness. This is what he's given as a claim, and he says that this is primarily the reason. But the reasons also are that many of these infants were put together, had to be accommodated in one of those incubators. So one incubator was being shared by 3 infants, at times 2 infants, and you know, this is a clear indication that there is a lack of infrastructure, because one incubator unit is supposed to be used for only one child, for only one infant, but in this case there are 3 or at times 2. This really shows the poor infrastructure that our hospitals have. Also, the NCP MLA Jayant Rao Jadhav, who had visited the civic hospital there this Thursday, he says that the hospital has to treat more children than its actual capacity. Now, what does this say? This really says that the infrastructure is lacking. The hospital does not have adequate rooms, adequate units or incubator units to facilitate these children.
And Pragya, this is not only lack of infrastructure now, it is evident that it's also lack of intervention by the relevant authorities to try and solve the problem. The country is going through a series of similar incidents, infants dying at a very, very young and a premature age. What is being done to prevent these deaths? This is in fact murder, if one could actually point out.
Right, so the Health Minister of Maharashtra, Deepak Sawant, he said that, you know, it is a fact that infants are brought to the government hospital at the last stage, but he says that a protocol would be implemented soon in private and government hospitals. He's also said that neonatal experts committee is being formed for prevention of neonatal mortality. So this is what the government has been saying. The government has, you know, said from their side. But as we see that the situation here at hand is really sad, and the sorry state of affairs, which has, you know, caused the death of 187 infants since April and 55 deaths reported only in August.
All right, Pragya, we'll leave it at that. Thank you for joining us on the program.